My name is Carol Matz, and I am a traditionally trained naturopath in Brook, Virginia. And today I am so very pleased to introduce you to Lisa Klein, who is the Director of Total Health Physical Therapy. We are holding this interview in her Washington, D.C. office, although she also has an office in Herndon, Virginia. I met Lisa last spring when we attended a conference together, and it was hilarious because on the way back to commute back to DC, we found that we were getting on the same train. And so we sat together and we talked the whole way back. And so I became completely fascinated with her line of work. And as she continued to tell me more and more about what she did, because I had no idea what it was, then I asked her if I would be able to interview her to put on my website so that I could share her talent with you and introduce you to what she does. And you may be interested in seeing her at some point in your wellness track. So Lisa, it is an honor to introduce you to my clients through my website. And thank you so much for taking the time from your incredibly busy schedule to do this, to educate us on a topic that we don't know much about. And the topic is Integrative Manual Therapy, which is abbreviated IMT, and that's how it will be referred to from now on in the video. So when you hear IMT, that's what we're talking about. So first of all, I have really come to appreciate the word integrative. Like me, I'm sure there are several people who have read the word integrated in medical practices and have absolutely no idea what it means. So can we just jump right in there and talk about the word integrated into a practice, and then
Sure.
tell us a little bit about yourself and your practice.
Okay. I'm a traditionally trained physical therapist, but I've always been more of what's called a systems thinker. I've always looked at what are all the components that make up the whole instead of looking at things individually. And to me, that's the essence of something that's integrative. It looks at everything. So, for example, as a physical therapist, we're trained to work on necks and backs and shoulders and hips and all that. But for me, it just seemed like there was something missing, that we're not looking at the whole person to see if we can figure out what's really happening in that neck and that hip and that back and that shoulder. And it just seemed like there was a whole other piece missing from my training, which was good. I went to a good program and I had good education, but when I got into the clinic, I was just very frustrated, and I felt that I wasn't really able to achieve the results with my patients that I wanted to, and I also felt that we were asking patients to do things that were physically impossible. For example, my first job out of physical therapy school, I worked in an inpatient rehab unit, and we treated patients who had had strokes and total hip replacements, total knee replacements, and it was all functionally focused, meaning we'd work on getting back to function and how to get back home, which was appropriate, but we weren't really working on them. And the setting that I was in was focused on getting patients up and going so they can go home, which was totally fine. But then I was transferred to the traumatic brain injury unit. And when I was on that unit, it became much more obvious that what we were asking patients to do was almost ridiculous, because these patients had had severe head injuries from car accidents or other injuries, and we were pushing them to pushing without actually addressing their problem and what had happened to them and the damage to their bodies. And it just seemed to me like we were missing half the picture, which was you can't ask the body to do something without actually fixing the body first. So when I was in physical therapy school and even in college, I had friends who were going to chiropractic school, and I had friends who were massage therapists, and so I knew there were other modalities, like other ways of doing things, other professions, and I started looking for training programs that would really help me to learn what I really wanted to learn, which was how do you do the structural component, how do you fix the body enough, and then you ask it to do something that you're trying to force it to do, which half the time doesn't actually really work that well. Mm-hmm. So for me, it was a journey of being kind of unsatisfied with what I learned, and also just kind of, how sometimes you just know something? I just knew, we're missing half the picture here. And so when I graduated from PT school in '91, I worked for a year, and then during that time when I was working in the hospital, I really started to think, okay, I need to start to take some classes and find people who are thinking the same way that I'm thinking here. That's how that happened.
Fabulous. So have you had an injury yourself that
That's an interesting question, because a lot of people who get into this line of work have had injuries. I've been very lucky. The only thing that I know of that happened to me was when I was a little kid, and this guy jumped on my back on a trampoline, which the memory came to me or during a session of manual therapy, and I was like, am I imagining this? And then I called my parents. My father said, no, you came home with footprints on your back and you had this injury. And so I've had, as we've talked about, my neck, and my neck is my fragile area, so I'm always working on how do I get my posture better on my neck. So it has been for me, but also, this is kind of the personal part of the story. I had a younger sibling who died of a brain tumor when he was a baby, and I think that had just a huge effect on me in many ways in terms of, okay, why couldn't we help that? And when I was in physical therapy school, I remember clearly the thought that I had in my pediatrics class, which was, we can put a man on the moon, but we can't fix a kid who has CP. Like, what the hell? What the heck? That is totally unacceptable. And you think about what we can do as people, and we can build these skyscrapers, we can go to Mars, we're doing all this stuff, but we can't fix each other. It just is totally unacceptable to me, and it's also ridiculous and just not okay. So anyway, I kind of had my own just spinal stuff that really isn't even that bad to deal with, but it was more, honestly, it was more the humanity picture of it. Like, why are people having to suffer, and why are we putting so much energy to this other stuff when we should be putting this energy towards figuring out why can't we fix each other?
Okay, well, there we go. So when I was getting ready to have this interview with Lisa, I went to her website, which is totalhealthptdc.com, because I had some questions I wanted to ask her, and I thought, well, why don't I just go to her website and see if my questions are already answered? And most of them were. So IMT is a combination of literally thousands of techniques and represents a huge step forward in manual therapy care. So Lisa, let's just stop there for 1 minute. And when you say a combination of literally thousands of techniques, can you name a few?
Okay, so the bigger picture thing is that the body, as you know, is very complicated. And if you're going to work on the body, you have to have techniques for each structure. So the thing about the aspect of IMT that really resonated with me was that it's complicated, and it breaks the body down system by system. So the nervous system responds completely differently to trauma than the vascular system, and muscles function very differently than, the lymphatic system. So if you really want to be working on the body and making changes, you have to have techniques that are specific for each individual tissue, hence thousands of techniques, because we have, there's a technique to release every single nerve in the body. So there's a couple hundred techniques just in that one class.
And hence,
and then
hundreds of hours of training.
Hundreds of hours of training. Yeah, I've had close to 100 continuing ed classes, and so I was very lucky. I actually started a practice when I was in Georgia, and I was close to a doctor in Atlanta who was bringing the classes there, and I had, during my quest to learn all this, I had taken several different other trainings. So I studied a few other kind of total body classes that really didn't resonate with me, and then I took several classes through the Upledger Institute in Florida, and that's the place of John Upledger, who has pioneered getting cranial sacral into more of the mainstream. And Sharon Weiselfish G. Mateo, who mentored me in IMT, and she's the developer of IMT, she was teaching for Upledger at that time. And then she kind of took, not his material, but it was the philosophy, and then she took it several steps further. So, and the way, because she's a physical therapist, the way that she thinks really resonated with me, and she's a systems thinker, so just her whole shtick really resonated with me. So I took about 6 or 7 classes through the Upledger Institute, and then I switched to her training program. And that was about in 1994-95, and that's when I did the majority of my training through her. And then she was opening up satellite offices, so in 2001 I moved to DC to open up an office for her in Washington. and then I continued my training, became certified, and then I started teaching for her in 2002. So I've taught nationally all over the U.S. and internationally.
Wow.
So
you know your stuff.
I do know my stuff.
That's awesome.
This is true. To
And
the
it shows.
exclusion of other hobbies, which now I am getting back into because it was a lot of training. But yes, so what I really like about the IMT is that it's real, it's true. It's like, okay, you know, what's going on here? What's going on with the bone? What's going on with the ligament? What's going on with the tendon? What's going on with the muscle? What's going on with the nerve? What's going on with the artery? So you can take any part of the body and break it down to such a layer of specificity that you can actually do something about it. So you have to have this layer of specificity to actually make changes.
So Lisa, I'm going to skip over another point I made here because we're in this track here. But when a person comes to see you, let's say for the first time,
Right.
and you're evaluating them, you know, can you just give us a little, you know, I mean, we don't want all your secrets, but what is a snapshot of what a person would expect when they come to see you for treatment?
What we do is we take a very detailed history. Our intake form is like 17 pages. It's ridiculous because we want to know everything that's happened to you. Not that most people remember, but just what you know. And then when you come in, how we assess the body is through the fascial tissue and the fascial planes because that's what holds the problem. So most people are familiar with the fact that you can have a spinal problem like in the neck that you can feel it in the arm because pain radiates. So it's kind of along that line. The game is how do you find where the actual problem is.
Right.
So the fascial tissue loads where there's been the most problem. And it always tells you what's going on. So it has nothing to do with the patient believing in me or the patient having whatever. It doesn't matter what's happening on the patient side. You can feel the load in the fascial tissue and get a general good idea of what's happening in that patient's body and then try and find where the crux of the problem actually is. Because most people come in to get treated when they've hit, you know, things have become so bad they're actually paying money and going to get treated. You know, who wants to do that? So
basically pain management at that point.
Well, it's they have a problem.
Right.
Most people don't come in because they're curious as to what loads they're carrying. You know, they're not like, "Whoa, I fell on my butt 10 years ago. I'm wondering if maybe, you know, I want to preclude any problem." People don't do that. They come in when they have pain.
Okay.
Right. So so when they come in, we listen to what they're saying, but then we look and see, okay, why do you have pain? And most of the time, 99.9% of the time, well, depending upon the situation, you're looking for things that are older, that are still bothering the system, that were never fixed. Mm-hmm. Does that make sense?
Yes, it does. Yes,
okay.
It does.
And often it's not really where like I have a patient who came in with this foot pain that she's had for a long time, can't figure it out, blah, blah, blah. Feeling her, you know, working on her foot was just not that interesting to work on. It didn't seem like there was much happening there. Her sacrum, however, was a disaster. So, and she had a very bad sacral injury. So from a perspective of how do you actually make changes for this woman, working on the foot I don't think is going to make it. We have to actually work where she actually had an injury. Now she's coming, does that make sense? So she's coming in with a foot problem, but the foot is just at the mercy of the other actual damaged area, which is the sacrum or whatever.
So we always are joking about, we're all connected.
We are, you know? We in fact are all connected.
And so you're kind of like me in my field, except in your field, being the perpetual 2-year-old asking why.
Yes.
Why is
always.
This foot hurting?
Yes.
Why is this inflamed here? And
right.
if I touch this area and there's not a lot of energy there, where is the energy blocked?
Right.
So that's a basic, in a nutshell,
right.
kind of
right.
thing that you
Well, you're looking for where is the actual problem? Why hasn't it healed? Because most people are active, people aren't morons, like they know, you know, if I do this, if I do that, you know, people will try and fix themselves. So most people, when they have an issue, we have tools these days. They can go to the gym, they can get a massage, they can do yoga. When people come to see me, they've tried all that and it hasn't worked, you know, so usually when people come in with an issue, the problem is usually often not where the actual symptom is. And often it's not something that's an easy fix. I don't get easy fix patients. I get people that have been in pain for years and nobody's been able to help them. So, you know, and in order to really make changes, you have to look at everything and have a way to do that. And You know, CAT scans are okay, MRIs are okay, they don't see everything by any stretch of the imagination. And so many times people come in and they've already had all this testing, it didn't show anything, and yet they still have all this pain. So the hands are infinitely more sensitive and can pick up all of these loads, wherein so many times things are missed. I actually had a patient break into tears the other day. This was so precious because he's got this issue in his leg, and it feels to me like it's coming from the bone, and that's what he's been saying the whole time. And he's at MRIs, and they didn't show anything. And I said, you know, the MRI is not going to. People think it's the being all and end all, but it doesn't. There are a million things that can happen that are not going to show up on an MRI, but you can feel it with the hand. So it's a very nice tool to have.
That is trained hands, right?
Yeah.
Do you insure your hands?
I should. And I actually should also polish my nails, which I never do. Anyway, moving on.
So again, going back to your website,
Mhm.
I read something interesting that made me have a bit of an aha moment that I wanted to ask you about.
Okay.
It says here that IMT focuses on relieving strains in specific tissues that have been damaged due to trauma, infection, or inflammation.
Yes, this is true.
Now, I think most people understand tissue trauma due to an injury
Yes.
or, you know, damage that way, or
Right,
from
right.
inflammation. But
Yeah.
infection, that's kind of an interesting one. Can you elaborate on that a little bit?
Well, anything that changes the function of the tissue is going to leave behind a trail of scar tissue. And also, infection will often change the whole area there and leave it more vulnerable. So what we're looking for is what happened to that person. I'll give you a great example. Okay, so I had a patient come in, he's young, he's in his 20s, you know, fit, he should be totally fine, right? But he's having all this pain. So we're looking at him, and we keep feeling in his head, because we do a lot of the cranial work, that his dura, which is the main membrane that surrounds the brain and spinal cord, is really tight. We can barely move it, which is unusual. So we keep asking him, what happened to you, what happened to you, what happened to you? And he's remembering, you know, all this asthma issues, like things that have happened to him in the past. But it took him a few visits to remember that when he was a kid, he had bacterial meningitis when he was, I think, an infant. And we're like, okay, thank you, you know, because what that does, especially meningitis, is it locks everything down because of the scar tissue. So this kid is very tall. So what had happened was he had the inflammation, it created scar tissue, everything had to grow. So here this kid is with pain after pain, injury after injury, problem after problem, because he's got all this scar tissue that actually is keeping everything from moving internally. So it's kind of, it's a strange concept, but everything has to move. You know, everything
Exactly.
has to move. So
Yes.
every cell in the body needs to be mobile, and if not, that's when you start having problems.
Okay, thank you. That's
welcome.
very interesting. I'm sure that we're all learning something.
We were very
here.
happy that he finally remembered that, because we knew that there was something there.
Yes, absolutely.
Yes.
So I appreciate that on your webpage, the cost of treatment,
Mhm.
insurance coverage, and how to contact your office
Mhm.
for an appointment is all very clear, and it's all on one page, on her fact page. That's frequently answered questions for those of you in my age group who don't always know what fact means. Okay, so there are two more questions I have, in
Okay.
addition to the ones you've already answered.
Mhm.
Okay, so number one. I generally think of a person needing physical therapy
Mhm.
who has had a broken bone in a joint that bends, as the joint has to be kept still during the healing process, usually by wearing a cast,
Mhm.
correct? Okay, so when the cast comes off, some physical therapy is usually ordered by the doctor to restore motion and
Mhm.
function to the joint properly. So that is something that a doctor would order. Now, is IMT the same thing as physical therapy?
So I'm a physical therapist. So my licensure and my training and my degree, and I'm boarded as a physical therapist. My preferred way of treating is by using IMT. So IMT, at this point, the developers would like it to be considered its own profession, but it's not anywhere near that point yet. I was the founding president of the board of the IMT Association. They started the professional association in order to start to get it to be more something that could be then licensed at a certain point. And they have the diploma diploma program in Connecticut is accredited through the state of Connecticut as a like a technical school at this point. So years and years from now, at some point, it may be its own profession, which would be great. But for now, it's a treatment modality that is used by people who have had the training. So again, I'm a PT, there are chiropractors who have gone through the program, massage therapists, occupational therapists. So it could be a PT or it could be another profession.
Okay.
So
Okay. So then how would a person learn about IMT?
that's a very good question, because unlike other people, we are pretty, what's the word I shall use here that I can say on camera? We are not so great at marketing. So we're crappy marketers, basically. So I've been in DC for 12 years. This is my second practice. My first was with the Connecticut folks, and we had a very successful practice with no marketing for 9 years. It's all through word of mouth. So, but where it is now is that I'm developing my team, and we want to have more exposure, as it were. So now we've done the brochure, that's why we have the website. So what's happened historically is that people know me from teaching in the area, because I've taught several classes in this area. So therapists will send me their more complex patients. Mm-hmm. So I get a lot of referrals from physical therapists in the area, and also different types of other therapists as well who know me. And then we have just a lot of word of mouth. So patients telling their friends and sending people in. In DC, we don't need a prescription from a doctor to treat. So I do have doctors who know of me, but we haven't spent a lot of time developing those relationships, which would be really good for us to do, actually. In Virginia, we do need a physical therapy prescription to treat, so we are kind of working on that in Virginia, how to make that happen. Because it actually happened yesterday again. A patient came in, she heard about me from a friend of hers, and she was like, I have been looking for exactly this. She's like, I knew somebody out there was doing this work, I didn't even know what to look for, but this is exactly what I want. I want somebody who thinks this way, who's holistic, who's going to look at everything going on with me. So people really like it, especially in this area, because everybody's really smart. In this area, people are super bright, and they know when something's working, when it's not working. Mm-hmm. And the work that we do, moving to DC, when I first got here, I'm thinking, okay, I'm going to be doing this on K Street, and it's very light and gentle, and you're like, people are going to think I'm crazy. But no, because people come in and they don't have the time. Everybody in Washington is in such a hurry, and they want you to fix them right now. And you say, okay, I'll do what I can. And you put your hands on and you find the problem, you fix the problem. So it's gone very, very well in Washington because we can produce results. We always do the best that we can. It depends on how much we can do for each person, but we can at least try. At least we're trying. So I had another patient recently say that at least, she's wanted somebody to take the time to really try and figure out what was going on. Mm-hmm. And we really do that.
That's awesome. I can't wait I want to do this myself. However, fortunately, I am a very fortunate person to be in very good health. And I have been working on my health for about 15 years now.
That's great.
And I'm past all the symptoms that started me on this journey of figuring out how to make myself better.
Right.
So now I'm on the forward end of how do I continue to be well.
That's great.
And I know there are a number of people in the natural health community who feel that way. What kind of modalities can I bring in to keep myself in a well place? Mm-hmm. So for somebody like me and others who are in that position, mm-hmm. would we benefit from IMT?
I feel like, this is going to sound, whatever, but I think the thing about IMT, because you're trying to feel the loads in the body, you will find things that have been there for years, may or may not, but could cause problems later on. So very often what happens is people come in and they get treated, they feel better. And then I can't get rid of them because not that I want to, but I love my patients, but they see, okay, well, how much better can I feel? Yeah. And then they know it kicks to preventative. So, I have several patients who I've seen on and off for years. They're in, they're out, they come in when they have a problem. I have some people who just come, for tune-ups, but then people who just know that it's preventative at that point. You know, they'll just come in every however long and just get treated.
Mhm.
So it's an interesting situation because it's a nice way to be able to say, okay, let's, you know, with everybody, you're clearing load by load. So you're clearing the most acute load, and then you're going deeper, 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 deeper. And then you're bringing it up, and you're trying to do what you can to get it out. So basically, it's making it so that things won't become problems later.
I'm
So-
all over that.
That's what that, yeah,
I
that's
love
fabulous.
I love that, and I love it that Lisa is so passionate about what she does. It just makes me want to jump on the table and get an exam right now. But I think I've come to the end of my list of questions.
Okay.
So I just wanted to thank you once again, Lisa, and
course.
I really hope you've enjoyed this introduction to IMT. And again, the website is www.totalhealthptdc.com, and it'll be on the screen for you, as well as the telephone number. Go to the website, check it out, and I know Lisa would be happy to work with you either in DC or in her Herndon office.